Welcome. My name's Deirdre. I'm one of the trainers here at Exxon Health. Thank you very much for joining. Just a quick bit of housekeeping, just to let you know that this is going to be recorded today and you'll get a copy of it sent out to you soon. Also, my colleague Tara is facilitating the website, so she's in the background, putting any links in that are relevant, and also if you do have any questions, please do feel free to put them into the chat box and Tara will endeavour to answer them as we go forward. Okay. So today we're just going to take a look at the new and improved telephony reports and the dashboards that we've made available to you in the reports console. By migrating our reporting engine to Google BigQuery and Microsoft Power BI, we're able to provide more accurate and interactive insights to help you make better decisions around your workflows and patient access routes. So what does it mean? By moving our data to these platforms, we're now able to handle much larger, much more complex data sets. This allows for more detailed historical tracking and more complex calculations that weren't possible in our previous system. Microsoft Power BI transforms your raw data into interactive experiences. You can now interact with charts, drill down into specific metrics and customize your view to see the data that matters most to your practice. Also included are the new and improved feature reports for surgery intellect and omni consultation if you are currently using those features. I'll show you briefly towards the end of the session regarding those. What are the benefits you'll gain from the new reporting format? Well, you're going to get better visuals, dynamic graphs, KPI tiles and color-coded charts. These make it easier to spot trends. Staffing insights with the addition of people answering overlays on top of the queue charts and the enhanced tracking of staff statuses. It will show you a better view of how the staff are managing their time. The SMS tracking, we've now got new segment tracking for the SMS reporting. It means you can accurately view your practice's spend on SMS. And targeted analysis. You can use the new Weekday Selector to view specific days and quickly pinpoint the high pressure times. And we all know when they are usually. You can filter the date, the queue, and the inbound number. Even choose which day you want to see. The imaging clearly shows the data for you. Let me just show you that. There's the dates that you can choose. There's the queues, which group you want to look at, and which number you want to look at, main number, and even the weekday. You can choose which day you want to look at. Now, on those squares, if you hover your mouse over any of those boxes, 3 little icons appear, which are these here. The first one that looks like a funnel, this one here, that icon will actually show which filters are currently on, affecting that specific box. The square in square, which is this one, that icon is the focus mode. It expands to full screen, so if you wanted to have a closer look at it, you can. And the more options, the 3 little dots, that enables you to export the data. So that's where you would go when you want to export it. Also, it can show you're able to show it as a table, and it will also give you a link to get insights. Now, this is a chargeable reporting package which reports not only on telephony, but other things within your practice like the NHS app usage and much, much more. Information on that you can get from us. It's possible to select any data point to instantly filter the entire dashboard, allowing for a deeper dive into specific trends. You're able to hover over graphs to see numbered statistics for each data point to really get to grip with the figures and further analyse this data. I'm going to talk you through the main changes that you'll benefit from with this new reporting. Now, just to let you know, the mass rollout of this new reporting features began on the 1st of June. So if you don't have it available to you yet, you will do very soon. It will be rolled out to you. Now, the first one, the service summary, this serves as your practice's primary dashboard, so providing an executive high-level view of your entire telephony service. It acts as the front page for all your other reports. This overhauled landing page, it used to be called the overview page, provides an instant snapshot of your practice's data. We've made the following improvements in the enhanced reporting release. You can use the data slicer to narrow down your data to specific time periods. We have also added charts showing call volumes over the default 7-day period and their outcomes. And it now also includes a summary of your enabled products and features here across the bottom of the screen, so you can see what you've got and what's switched on for you and what isn't. Didn't have that before. Now, the two call reports, inbound and outbound call performance, include a number of tabs to allow you to dive deep into the patient behaviour. You can evaluate staff responsiveness and pinpoint system bottlenecks, giving you the data you need to eliminate wait times and improve the access for the patient. We've merged the inbound call statistics and the inbound call number overview that we had in the old reporting into one page. That just helps you kind of reduce the navigation time. Also, there's dedicated hourly views to keep your main dashboards clean. Hourly breakdowns, they've been moved to a separate subpage. So it just looks a little bit clearer for you. The other tabs available for the inbound reports is the menu selection and talk duration reports, very useful reports. Also here, you can see you now have access to brand new reports specifically for monitoring outbound calls, which we couldn't do before in our old reporting system. They also include the new dedicated hourly views that we saw in the inbound call performance. You have that for outbound as well. So if that's important to you as a practice, you've now got much clearer vision on it. Now, moving on to the group reports, these help you track the journey of every call from the moment it enters the queue. This report is a really important essential report because it provides proof of patient demand. By monitoring the flow of the traffic through the specific groups, you can gain a high-level view of how the groups handle these calls. In this release, we've updated the logic for missed and answered calls. These calculations now exclude the abandoned calls, giving you a more realistic view of your team's workload. As you know, the abandoned calls are the calls that have not got as far as your queue. Okay. The patient callback report is improved. It's improved the accuracy to help you better understand how this feature impacts your queue management and all the usage of it. And moving on to the user reports, this is also improved. This provides a really granular look at how individual staff members interact with your surgery's phone system. It allows management to track productivity, identify training needs, if anything needs touching on there, and ensure that the staffing levels are sufficient to meet patient demand. We've enhanced the accuracy for staff status tracking, providing better visibility into team availability throughout the day, and you being able to see what the staff are doing on an hourly basis. For the detailed info on this report, have a look at our help guide. My colleague, as I said, Tara, is on this call as well, and she is going to be adding lots of links into the chat box for you, including the help guide on the user reports and all the others. Now, the SMS report has changed slightly. It now provides a comprehensive audit of all the message communications sent from the surgery to the patient. and it will track the volume, origin and delivery status of the messages as well. And this release, we've consolidated multiple SMS pages and added new charts to help you track messages sources and delivery outcomes more efficiently. Feature reports, which you have currently, the new and improved feature reports provide a detailed look at how specific features are performing within your practice, such as things like check and cancel, personalised call routing, queue position web page. If you're not sure about any of these, again, you can come to us for help on any of those things or help setting them up. All the guides and the contact details will be put into the chat box for you by Tara. This allows the management really to track the efficiency of self-service tools, identify technical integration issues, and understand how patients are interacting with the system outside of direct staff contact. The report will show patient self-service success, integration efficiency, analysis of priority routing, digital queue engagement. With this new release is improved responsiveness. The check and cancel stats page has been optimised to handle data more effectively, making it easier really to audit patient-led appointment changes. And we have the management report still in here. You have got that already, but we thought it was just worth a quick look at the overview style. As you know, the monthly management report is sent out at the beginning of each month by email. This report is meant as a high-level view of the previous month's activity and is presented to you in PDF format. It can be exported or printed out. An archive of your monthly management report is still available via the reports portal. We'll quite often actually get asked, how do we add a recipient to the report distribution email list? You can do this yourself via the configuration console and global settings. If you need help with that, again, contact us. It's no problem at all. Okay, if you're using our ambient scribe product, Surgery Intellect, powered by Tortoise, you're going to have access to this report as well, and it will analyse the usage of this feature. If you don't currently have this, clicking on the report will just take you to like a splash screen that will allow you to request information if you were interested in it. Again, it's a really, really useful time-saving feature for your clinicians. Specific Intellect demonstrations can be booked. So if you are interested, please contact your customer success advisor for a link, and they'll book it in with us trainers and we can do a demonstration for you. No problem at all. The Surgery Intellect usage report, this provides you with a detailed view of how your clinicians are using the scribe. This report provides a detailed breakdown by selecting the relevant tabs across the top. This data will refresh overnight. You can track the total use of the Intellect and when it's being used. You can track the estimated staff time saved from using it. So how many hours per week the clinicians are saving time. The methods used to start Intellect, so it can be used on a call or it can be used face to face. Okay, and the report will show you which is being used. And the number of transcriptions, clinical coding, and the medical notes generated. It will show that, and it will also show you the individual user activity. So very, very good full report on the Surgery Intellect powered by Tortoise Scribe. Now, our Omni consultation is one of our newer features. This allows patients to submit medical requests directly to your practice, and it will also be reportable. If you have got this new feature, you'll be able to view a usage report on this. This report provides a comprehensive view of how your practice manages patient triage and digital requests. By bringing all your data from web forms, voice automated forms and manual phone bar interactions, these reports will show you the patient's journey from the very start to the end. If you do want to learn more about these reports, have a look at our detailed user guide via the link which my colleague will put into the chat. It's really useful and interesting to see. These reports show you some of the areas that you can look at. For example, you can see volume and demand. You can track total submissions across all medical and admin requests, pinpoint peak demand times to ensure that the right staff are available when the call volumes spike, and watch for the long-term trends to help with seasonal capacity planning. On another, it compares patient preferences between the 3 types. We have the voice agent, the web forms and the manual entry. You can see which one is most popular, and you can check how efficient the system is identifying callers. You can even look at what stage the request is currently at, so seeing which staff are most effective using this process with the consultations, and also identify any bottlenecks that may occur. Finally, use the detailed activity logs for full audit trail of every configuration change or form access. You're able to analyse consultation outcomes like completed versus hung up, which will enable you to improve the patient experience and ensure all data is syncing correctly and working correctly with the clinical system and the single sign-on. We do have our supporting resources for you. As I said, my colleague Tara will have added all the links into the chat box for you. But if you do want any further information on anything that we've talked about today, you can just email our customer success advisor she will put it into the chat box, but it's just customer success, or one word, at x-on.co.uk. And that will go to the group email box. Or if you'd like to book a training session on the new reporting features, you can contact us here in training, and our email, which is training@x-on.co.uk. Again, that will be put into the chat box for you. You can contact us to book anything that you wish, any training on it. And finally, if you want to know more about our Surgery Intellect or Omni consultation features, you can just reach out through our contact, which will register your interest. Again, this link will be put into the chat for you, and you'll be contacted straight back. Right, so just finally to finish, I just wanted to let you know about one more thing. It's not to do with reporting, but I thought it'd be a nice time to tell you. We've got a major upgrade coming to our academy. It's going to have the same URL and your same login to get into it. It's just a whole lot smarter. What it will do is you'll be able to benefit from an improved course catalogue. It's easy to search, which you couldn't do before, and find the course that you need. You can access new learner pathways to find courses specific to your role. You will also be able to make use of the integrated note-taking to help support your knowledge and be able to refer back to this at any time. And finally, there is a new management dashboard. So the managers with supervisor access will be able to track the staff completion. So you'll be able to see whereabouts your staff are on the academy and whether they've completed sessions or not. And so if you watch out, you will be communicated about this. So we think you'll actually love it. It's going to be really, really good. And it just makes the whole thing a lot more easy to navigate around. Okay, so that is the end of this webinar, slightly shorter than the 30 minutes that we've allocated, but I hope you got something out of it. So again, if you need any more information about anything, please let us know. If you have put any questions into the chat box. I hope that you've got the answer that you want. If not, we will come back to you on it. And as I said before, you will get a recording sent out to you, emailed out to you very soon. So on that note, I'd just like to say thank you for joining, and goodbye from myself and my colleague Tara. Thank you. Have a good day.